So first, I just wanted to get a sense of what this initiative does. What are you trying to do? How are you using data to help cities look differently at their criminal justice efforts?
Well, first of all, it's incredibly important to make sure that when you think about addressing public safety, that you involve community voice and that you involve a broad sector of the community, because the criminal justice challenges can't just be solved by the police. The police have to be partners in it, but you also have to have partners in health and education, as well as all the other interstitial connectors that make up the challenges that exist in these communities. So what we're doing is we're working in partnership with all of these stakeholders to actually gather data that can be used to make and comprise what we call a justice audit, and then use the justice audit data to actually come up with what we call a justice reinvestment plan targeted at specific neighborhoods that have a long history of overlapping inequities and high violence and crime.
Now, are cities eager to be audited justice-wise? That doesn't necessarily sound like something that a city would sign up for. You know, maybe they're afraid of what the data will find and show.
No, not really. I think what happens is, first of all, keep in mind that we are intentional about working specifically in those jurisdictions that are mid-sized, micropolitan, and rural jurisdictions. Many of these jurisdictions have been completely overlooked, and they're actually really eager to partner with organizations to actually, work in partnership with them, to give them the tools necessary and able to focus on the challenges that exist in their communities. And when you think about audit, it's not a situation where we're coming in and saying, we're gonna audit you, and you think about the word audit, it sounds like a bad thing.
It does.
That's not what we're talking about. And the thing that we come up with in terms of challenges working with partners, for example, is, if you're the police department, they're like, I don't want to know if we want to give you all our data because people will attack us. Or if you're in the school district, they normally would say, oh, I don't want to give you the data because people will attack us. But if you actually bring everyone around the table together and everyone has a shared understanding and everyone is able to actually put their data at the same level, then people are less apt to be afraid of it. And it's not what you call a traditional audit. It's all of us sharing information, sharing data, being reflective on that data, and then using that data to make different decisions around policy.
I know a big topic of conversation in city government right now is recognizing the problems that they've had in recent years, of recognizing the data they have and being able to bring it together through different sectors of the city. How does bringing that data together allow cities to be more effective in tackling the problems that they have?
Well, because, these problems are so challenging and difficult. You can't have one sector to be responsible for the whole thing. For example, when you think about crime and issues of safety, it's not, as I said before, it's not just the police, it's not just the school district, it's not just the health department. And I think what happens is people who are in these organizations really want to see what it would look like to actually bring those data together in ways that are strategic and that recognizes that the problems are complex and thus they need to have a complex solution, particularly anchored in data.
The conversation around exactly what you're talking about and just kind of like making the lens bigger when it comes to thinking about the solutions that are available in the world of criminal justice and crime, obviously became, the national conversation after the killing of George Floyd, in a way that previously maybe it had been, the domain of people who really follow this stuff. But afterwards, people in all kinds of cities are like, okay, maybe some of these jobs aren't best handled by police. Maybe we need social workers here instead. Maybe we need different types of solutions instead of throwing police at everything. It sounds like those are some of the undergirding principles of this initiative. And so I guess I'm just curious, sort of now that you're doing this, what does this data tell cities they can do better than just throwing police at a problem?
Okay, so first of all, keep in mind that along with the justice audit, what comes out of that is the justice reinvestment plan. And keep in mind also that what sets this initiative apart than others is we're not just looking at statewide data, which is fine, county level data, which is fine, zip code data, which is fine. But what really tells a story, if you look at data and what we call hyper-local data, that's data that's not easily accessible publicly or commercially, when you look at the hyperlocal data and you start to code it and normalize it at the geospatial census tract level, that tells a different story. Because then we can go neighborhood, neighborhood, block by block, right? Because if you actually think about it, the statewide data, the county level data, the zip code data masks what's actually happening at the neighborhood level. So if we can provide those kinds of tools and data for cities and municipalities and jurisdictions to look at, then they can really target interventions at the neighborhood level that have been historically underserved.
So what are some of those indicators? What are you looking for? So say you identify those blocks and those neighborhoods where, say, a lot of the crime is happening,
Yep.
or, other problems that are arising in the city. By identifying those, then what?
Well, first of all, what I didn't say or mention is that it's not just collecting the data such as 911 calls or emergency room visits or shootings or anything like that. It is that. But we're also putting together what we're calling a crisis management cost index. Because every time you, and by the way, we're also looking at suspensions. Every time you push a kid out of school, there's a cost to that. There's an actual cost to that. When someone is shot and comes to the emergency room, there's a cost to that, right? So in addition to thinking about the data, it's also about how you're spending your money. And I think you can't have an understanding of what you're spending because a lot of these jurisdictions don't really know because of the disjointed data fragmentation. They don't know how much they're spending on all these things that are not completely, even though they're connected, they're in these little silos. So having the ability to bring all this together and to really think specifically about not only the programs we could actually use to help improve what's going on in neighborhoods, but really, are we spending our money strategically and thoughtfully in a way that helps to address the problem?
So I know that the work you're doing on this is focused on mid-sized cities like Grand Rapids, Michigan, Birmingham, Alabama. Why is that? Why mid-sized cities?
Well, that's easy. I don't care what the media says. When it comes to homicide rates, the highest, the top 20 in the United States, does not include New York City or Chicago or San Francisco or LA or any of those large cities. They absolutely include mid-sized micropolitan and rural jurisdictions. That's where the highest homicide rates are, such as St. Louis, Birmingham, North Charleston. There's a whole list, and I think it's important for us to focus on those communities because they have been historically underserved. And, we have not had as much attention on those places, and that's where the challenges are.
I think that fact is going to be surprising to a lot of people. What accounts for that? Why would these mid-sized cities have higher crime rates than the big cities that we talk about all the time?
Well, there's a whole reason behind that. There's the challenge around poverty. There's the challenge about racial segregation and historic challenges around that. There's issues around health disparities. It was very interesting. We were working in Grand Rapids and Birmingham and 20 counties in South Carolina. We did an initial slice of the data on particular neighborhoods. And this is when COVID was really, difficult. And we did all of these sort of overlapping pieces of data around neighborhoods. And so the same neighborhoods had the lowest poverty, also had the highest COVID, also had the highest level of diabetes, also had the lowest level of educational attainment, also had the highest level of people going to prison. It's all connected. And so if you think about the fact that not only are these places, these particular places that we're targeting have the highest homicide rates, they also have all of those other factors that contribute to it. So for example, when you look at the 20 counties that make up the corridor of shame, as we South Carolinians call it, we rather call it the corridor of opportunity once we continue to do this work.
And where in South Carolina is this?
This is along the I-95 corridor from the very top near Marlborough County on the North Carolina border all the way down to Hampton County and that entire area there. Represents 19% of the state's population, but contributes 47% of the state's prison population. It's also the poorest region, has the highest number of people of color, has the highest set of diabetes, you name it. They're all overlapping and they're all connected. And we have historically underserved them and we've not focused attention on it. And that's what this initiative is, what we want to do at Aspen, is to put our focus on those places that really need it.
So, I mean, it sounds like, I mean, you were talking about once you have the data, then you can figure out whether the city is spending the money in the right way. I mean, so does that mean, in some cases, reallocating some of those funds towards health, towards housing, and things like that to just sort of try to fix the underlying environment so it is less of a place where, where bad stuff bubbles up from?
Absolutely. So our partner in this work is the Justice Mapping Center, headed up by the brilliant Eric Cadora. Years and years ago, in the early 90s, when he was at the Open Society Institute, he did an analysis of every single block in Brooklyn and determined that the state was spending, on average, $1 million per block to send people to prison. And so his crazy, nutty idea was to say, instead of spending $1 million per block, why don't you invest that in education, in healthcare, in jobs, all of those things that mitigate against what we call criminogenic risk factors. So this is important for us to be able to think about that as undergirding our whole notion, and that is to say, instead of spending all this money in a crisis management approach, having a downstream sort of strategy, why not think about an upstream strategy that prevents this from happening in the first place by investing in those things that work? One of the other things that we do in terms of the landscaping analysis, which is a part of the justice mapping work, is to determine what is the geography of safety and justice. What do I mean by that? What are the programs that they're already doing, right? I mean, there's a ton of different programs that these jurisdictions are doing, and the question becomes, we need to understand whether those programs are actually working and whether they can invest, and if they are, why not redirect more money to those programs that are working? For those programs that are not working, maybe they decide in the Justice Reinvestment Plan not to invest in that particular program. So it's critically important to think about this strategically. Yeah.
I mean, you mentioned there sort of the idea of crisis management, and obviously, the last few years in America, like I can say as a reporter, it has often felt like, one crisis after another, something terrible happens in a place and the news media all goes there. That's the headline for a week or two. And obviously for those who are running city government, those crises are when you're in the news for all the wrong things. And I'm just sort of curious from your perspective, how do the solutions look different when you're planning upstream, as you mentioned, than when you're coming from a point of crisis? I mean, is the end result, the same, or how different is it?
It's different in the sense that leaders should have a new set of ways to solve challenges in their municipalities and jurisdictions. And what I mean by that is there needs to be a structure where people come together across sector. There needs to be an opportunity to have data analytical capacity, and there needs to be more of a focus on community voice. And a lot of people go to different schools to learn how to be a manager in a city, or but this is a different type of skill set that I think is important for leaders to be able to be exposed to.
I wonder how much, what are the sort of surprises that end up coming out of this data? I mean, I guess I'm curious from, if I'm a city mayor and you say, I'm going to bring in this data and it's going to show you, the problem areas in the city and what those problems are, I'm going to say most mayors probably already know what the problem areas are in their city. Maybe not at a block by block basis, but maybe, right? I mean, they probably got access to those crime stats from their police departments, and it's well known, where the biggest problems are. And so I guess I'm just curious, when you collect all this data and you say, here's also where the highest rates of COVID are and how much of the, here's everything else, how often are they really surprised by that? Or are they just like, well, okay, now they've got the data I sort of suspected, and now I can use this in a new way? Or like...
Well, when we did those analyses I was telling you about as a preliminary, no one was surprised about the neighborhoods they were in, right? But I think they might go into it knowing or having some idea of where the problem or the challenging neighborhoods are, but not necessarily have a holistic view of how you're able to think about budgeting as well as programs in a way that is really specifically targeted at those neighborhoods. Because if they already knew it, they would be doing it, right?
Yeah. So does your initiative give advice on things like budgeting? Is that part of the purview of this?
Oh, yeah. So what we eventually hope people to arrive at is something that we call, at least I call it, braided social purpose budgeting.
Okay, it's a nice name.
Well, you can Google it, but you're not going to find it.
Okay. Get that URL.
Actually, there's been some work already done on this, but not within the context of connecting it to a justice reinvestment plan.
Okay.
Has its bases from a justice audit. And one other thing I want to make sure I also put in here, because I keep mentioning community voice. Community voice is, in fact, a part of the stakeholders who are helping to collect the hyperlocal data, because the justice audit includes hyperlocal data, commercially available data, and public data. But the other thing that's also crucial is the qualitative data. What I mean by that is really having a chance to do co-constructed surveys with our community-based action research teams, which we have in these jurisdictions. And what they are, these are community members who help us eventually co-construct the sentiment surveys about how people are feeling about safety in their communities. Mm-hmm. They'll also lead the focus groups, again, focus on what does safety mean to you. And then we couple that part of it with the quantitative, which makes the justice audit much more fulsome and wholesome, and also gives a much more great basis for a justice reinvestment plan, because community voice has got to be central in the work.
Absolutely. I mean, I guess I'm wondering about sort of like the receptiveness to you, both from, I assume that the cities have come to you and invited you to be there, or did you approach them? And then likewise with the community members themselves, how do you find the reception to these efforts?
Well, we approached them.
Okay.
I
don't know if that's a good sign or a bad sign.
Well, we approached them mainly because of the data in terms of the homicide rates, right? And in the case of Grand Rapids, even though it's not in the top 20 in terms of homicide rates, when you actually start to dig down in the data, there's a lot of racial disparity in Grand Rapids across all these different sectors. So, one of the funders said, well, wouldn't they say, we don't want Aspen coming in and helping us. I mean, Aspen,
what does Aspen know about crime problems?
They know about, rural South Carolina.
It's a reasonable question.
It's a reasonable question. One of our funders said that. But thank goodness we had one of our directors, particularly the one from South Carolina, the marvelous Dr. Zenobia Edwards. I will say her name because she's fantastic. And she said, we actually want this help. We need this partnership to leverage knowledge and expertise, not just knowledge from Aspen, but also to uplift the knowledge that is inherent in those communities that have been so ignored.
Well, Doug, thanks so much for talking with me today and sharing the work that you're doing. I'm Laurel Wamsley, Cities Correspondent at NPR. It's been a pleasure to talk with you, Executive Director of the Aspen Institute Criminal Justice Reform Initiative. Thanks so much for taking the time.
Thank you so much.